This is a quick video to help get you ready for your upcoming pre-op appointment and surgery. If you're considering adding procedures or leaving any procedures off of your scheduled surgery, please let us know sooner rather than later to make sure the schedule can accommodate this. You might have been asked at your consultation to collect some old records if you're having a revision surgery. This could include your implant information or an old operative report. Women over the age of 35 who are having breast surgery are recommended to have a mammogram within a year of their surgery. If you have implants, you might have also been asked to get an ultrasound or an MRI. Some patients also require lab work or an EKG, and we will get you prescriptions to have this completed prior to your pre-op. And there are also some patients that require clearance from their primary care or a specialist, and it's best if this is done ahead of time. It's completely normal to get more anxious as your surgery date is approaching. We have seen that patients who are well prepared and not saving everything for the last minute are much calmer and better able to take in new information. You have access to these videos, and we recommend watching them multiple times before your pre-op appointment and before your surgery date. Everyone who has general anesthesia is required to have a caretaker with them the night of surgery, so please be sure your caretaker watches these as well. Read through all of your paperwork and create a list of questions that we can cover at your pre-op appointment. You may need to stop some things well in advance of your surgery. If you smoke, vape, or use nicotine products, it's important that you stop these 6 weeks prior to surgery. Also, we need everyone to stop over-the-counter blood thinners and untested herbal supplements 2 weeks prior to your surgery. Common over-the-counter blood thinners include aspirin, ibuprofen, and fish oils. There may also be some specific prescription medications you're on that may need to be handled, like prescription blood thinners or immunosuppressive drugs, and we'll work these out individually with you and your primary care before your surgery. Now, this is specific only for patients who are having an abdominoplasty or circumferential abdominoplasty or a body contouring surgery that lasts over 6 hours. Oral contraceptives can greatly increase your risk for a blood clot or deep venous thrombosis. We recommend that these patients stop taking their birth control pills and use an alternative form of birth control for 1 month prior to their surgery, and this can be restarted once their activity levels are back to normal post-op. If you're having a laser as part of your facial rejuvenation, remember you should start your skin prep, including a Retin-A product and a skin bleaching cream, 4 to 6 weeks prior to your procedure. Well, congratulations, you're off to a great start. Be sure you continue to watch all of the teaching videos related to your surgery, including the procedure-specific videos and your medication guide.